Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
And it's the veinclinicsofhawaii.com. Welcome back. If you've never been here before, hey, nice to have you with us. This show is being brought to you by Dr. Randall Juliff, the medical director of Vein Clinics of Hawaii. 4 locations, Big Island of Hawaii, the Kauai, Maui, and here on Oahu. We are mostly talking about the Oahu office when Doc is here because that's where we are. However, many of the procedures that are done here on Oahu are also done on the neighbor islands. And one of the things that always comes up, and I love this, we sometimes talk to patients, and we're going to do that next week. We've got another patient on. That's really a lot of fun. But everything revolves around blood. And I don't know about you all, but it seems to me, particularly on television now, and all of these shows that have forensic this and that, is you're seeing bodies at autopsies, you're seeing these things all open, and it's like blood all over the place. Some people, they just get absolutely squeamish when they see blood. And I hate to say that, but Doc, I'm one of those guys.
Really?
Yeah. I'm a bleeder. I mean, I bleed. But I know what I'm more likely to say to myself, but this is going to come up a little later on in the conversation, is, oh my heavens, what have I done to me this time?
Yeah.
How bad is this?
Right.
Okay. What happens? First of all, why do we bleed? That's number one. And number two, how do we stop bleeding?
Yeah.
That's clotting, where clotting comes in.
Right? Yeah. I thought it'd be interesting to talk about blood clotting because it's something that I think we all take for granted. You know, you cut yourself, in the kitchen or on shaving or whatever. You put a little pressure on it. You put a little Steptic pencil on it, and it stops. But but even before that, I guess that is a good question. Why do we bleed?
Yeah.
When we cut ourselves? Well, because when we're cutting ourselves, we are cutting tiny little blood vessels. In whatever tissue it is that we're injuring. So if it's the skin, and most of our skin is very well vascularized, so you made a lot
of little veins all over the place.
Yeah, little blood vessels, not only veins, but arteries, kind of little arterioles and stuff. When we injure ourselves or cut ourselves, we're interrupting blood vessels. And blood is coming out of those blood vessels.
Okay, now there's certain times when you get a cut, whether it's a laceration or a trauma thing, where there's not much blood. Maybe you got lucky. Maybe there's just a bunch of small vessels there. But every now and again, everybody hears it. Well, the guy bled out. Bled out means that you lose all your blood.
Yeah.
And so obviously some lacerations and some problems are way more important or way more dangerous than others.
Yeah, well, it depends on probably the part of the body that you're cutting. Because some parts of our body are much more, vascular than others. You get a little cut on your scalp, for instance, and it bleeds like mad.
Oh, yeah, a lot of blood up there.
Yeah. And so there's that. And then also it depends on, the location of the injury. If you're injuring the larger blood vessel that you're injuring, the more bleeding you're going to have, of course.
Okay, we're going to talk about a lot of things. How much blood is in you? And when you say you bled out, is it all gone? How much blood can you lose? How can you get it replaced? And more importantly, maybe some of the things that go on with people's individual bodies. Well, if you and I get cut in the exact same place, we may not bleed the same way.
The amount of bleeding or the bleeding time, the period of time that you bleed, it does vary a little bit from person to person, even in the normal setting. However, there's a range of normal, and for instance, bleeding time is one of those things that we do. That's a laboratory test. Yeah.
I love this. I knew that when we talk about this show that I was going to ask him in this. Didn't there used to be a time when a physician decided, we have to take some of your blood out. We have to, it was called bloodletting.
Yeah.
That's scary.
Well, and that's still done today. Now, back in the olden times, whenever that was, they thought that was healthy.
Yeah. Make new blood. Right?
Yeah, if the patient had an infection or whatever, they pulled blood out and, figured that was going to help. Obviously, it usually did not. However, there are disease states where people are either forming too many red blood cells, and even in those or in those specific situations, we do phlebotomy to get rid of a certain amount of blood, bring their red blood cell level down because if there's too many red blood cells, the blood actually clots more. I mean, it becomes thicker, and so. Now,
here's the thing: every now and again, when you're going to have some surgical procedure, if it's not the same doctor that's your regular doctor, isn't one of the first questions are you taking blood thinners, or are you taking any? What is a blood thinner? And I mean, that's why I'm guessing that if you're taking a lot of blood thinners, and your blood's going to be squirting out of you, it's maybe harder to stop.
Yeah.
Is that it?
That is true.
Okay.
Which kind of goes to that question goes to what does make the blood clot?
Yeah.
We kind of take it for granted. If we didn't have and there's a mechanism, there's a molecular mechanism within our blood that if given the specific events that occur, that mechanism is going to be activated. And
in other words, it wants to clot.
It wants to. When certain things happen, when you cut a blood vessel, that's one of the things that activates that. But if we didn't have a clotting mechanism within our blood system, we essentially every injury that we have could potentially be a fatal bleeding event.
Yeah.
So there's something called the clotting cascade. And, that's just the medical term that we refer to with respect to this, molecular mechanism within the blood that brings about clotting when it needs to happen. And basically these are proteins. We refer to them as clotting factors. There's a specific number of proteins, clotting factors that go into this clotting cascade. Basically, they call it a cascade because each step is an activation of one protein that then leads to the activation of another, and finally develops into something called fibrin and clot formation.
What a progression.
Yeah.
A lot of stuff going on.
Yeah, a lot of stuff.
By the way, you hear this too, and that is, we quite often help the blood bank. All of our stations do, and every now and again, when, like during the holidays, they're out traveling, but the need for blood is really high, and they say, well, when you donate blood, you're possibly saving 3 lives. Because of the different things that they can separate out of the blood, right?
Right.
Red cells, I guess plasma or whatever the other things are.
Yeah.
That being said, I want you to continue on this so people really get a good grip, not only of, okay, we're cut, but why is this bleeding? What are the things that affect clotting? And can you do something to make it clot? I mean, can you be proactive?
You mean, can we do something to help our clotting?
Right away, put pressure on it, get it up in the air.
Well, the obvious things, which actually, maybe not so obvious sometimes, but if you're bleeding. Yeah, the first thing to do is put pressure on it. Yeah, definitely. And if it's a vein issue, we've talked about bleeding in conjunction with venous disease in our legs.
Just spontaneous bleeding.
Spontaneous bleeding. That just elevating, as you said, elevating that extremity does a tremendous amount to stop the bleeding. But so there's these molecules that we call clotting factors. There's other things. There's something called cofactors, and calcium plays a role in various things. But and in getting to your point of the various components of blood, one component is a cell called a platelet.
Platelet, yeah, that's what I was thinking about, platelets.
And that's something
very important.
Very important as it pertains to clotting, because the clotting cascade works in conjunction with platelets to, for instance, if you if you make a cut in a blood vessel, that whole mechanism is going to be activated, and it attracts a bunch of platelets, and it creates something called a platelet plug.
Okay, which is maybe like a cork, maybe like a clot going to happen.
Like
here.
Putting your finger in a dike.
Yeah. Incidentally, and if you've been listening long enough, you've heard me ask this question before, and that is, if you take somebody that's got venous disease, and some of you out there listening have venous disease, and so this is very important stuff for you to know about blood clotting. But some of you, maybe you don't have venous disease, but you bleed. We all bleed. So one of the things I maybe point out was spontaneous bleeding. If you're vertical, like in a shower, this happens. It happened to me once. And it really is unnerving because all of a sudden there's blood coming out of your leg. You didn't hit it. You didn't punch it. What causes that? Or what are some of the causes that it could be? And instead of running out the door and jumping in the car and running to emergency, what should you be doing?
Yeah, I think what you're describing is
happened to me.
something that we see in venous disease, and like you said, invariably it happens in the shower when a small amount of blood looks like a huge amount.
Yeah, it's
of blood.
like Psycho. You look at
exactly that scene. Yeah. Typically that happens from just dilated veins on the lower part of the leg, where the skin can become very atrophic, thinned out, and if you get a little scrape, or when you're in the shower, probably because the skin is getting wet and it actually erodes through into that vein, and you can lose a fair amount of blood.
Yeah.
But should you run out of the bathroom and run to the car and get in and
no, because remember you're down.
Yeah,
and we're talking up.
Yeah, so. So the thing to do is to elevate that extremity. If you elevate it, probably it will stop just by virtue of elevating it. Mm-hmm. But if you elevate and put some pressure on it, then it'll definitely stop.
Okay, and we're going to go back on that, but I think there's way more important things. One of the things that I wanted to know is because when you talk about this, everybody bleeds, no matter what, and pretty often. And like we talk again about somebody that goes into like a diabetic, a dialysis person. Isn't that blood? Pretty much what we're talking about here. It's not clotting. It's running through a machine and going back into your body. But there is a danger, right? Because a lot of diabetics, they have no feeling in their feet. And they'll get a cut in the foot. They could bleed for a long time without even knowing it.
They could, but typically, in a diabetic ulcer, usually there's not a lot of blood flow. That's part of the problem. Mm-hmm. So typically, if they develop an ulcer on their foot, you're absolutely right. They might not know about it, but usually that's not a bleeding problem. That's a ulcer and healing problem.
But what I was actually meaning, I misstated it, was when you have a trauma to your foot. Yeah. If you're walking down the beach and you step on a nail,
you might not feel it.
And if you don't feel it,
sure.
If it's a big nail, it's a big piece of glass, you might be in big trouble.
Yeah, absolutely.
Okay.
Now on the flip side of clotting is, the next question is, if there's this mechanism within our bloodstream, within our blood volume, that's activated to create a clot, why doesn't everything just clot off?
Yeah, automatically. Yeah,
and the mechanism is even a little more extensive because there is sort of a counterbalance. There's another cascade and another molecular mechanism that actually keeps that clotting apparatus in check. So luckily that doesn't happen. Now, however, can there be problems with that mechanism too? Yeah, there can be. We'll talk about it a little later. But there's things like stuff called plasminogen or antithrombin, various proteins that if you're deficient in, then you can clot more than you should.
There's, by the way, a lot of late night TV ads. Once again, seems like every time you turn on any TV now, my wife and I say the same thing. Meds. They just got to talk about meds. Yeah, right. But a lot of it is about blood. And particularly, I guess, blood thinners for people that are either obese or so. Therefore, I'm reckoning that a lot of people listening to our program are on that, and I'm sure they know. But isn't it good that they get heads up every now and again that, hey, if you bleed, you need to really do something because you're not going to clot up like you should because of that.
Right. Yeah, sure.
How come? Is it watery?
Well, typically it has to do with the fact that there's a problem with that clotting cascade, that molecular mechanism in our blood is deficient in one thing or another, and that's what causes people to bleed. But it's like people with hemophilia.
Okay.
For instance, hemophilia is a disease process that you have more bleeding than usual.
Yeah, that's why don't they call him that guy's a bleeder.
Yeah. That's one of the forms, and typically in hemophilia there is a deficiency in one of those proteins. We call it a factor. We call it factor VIII. So in people who have a deficiency in factor VIII, now that's just one molecule in that whole clotting cascade, but it interrupts the whole thing. And so, they don't clot as well as they should. This is a genetic, problem. It's carried on the X chromosome. Since it's carried on the X, it's very unusual in females. So typically, we see it in men. But there's a spectrum, of severity in hemophilia. Some people it's very mild and it doesn't really interrupt their daily life all that much. Others, where it can be very, very severe and they lose blood or they spontaneously bleed. And,
I know people, Doc, and I'm sure you do too, that restrict activities because of that. They're a liability waiting to happen.
Oh, yeah.
Sometimes, and particularly maybe as we get older. And maybe more fragile. But there's another thing, and this is, as you know, Vein Clinics of Hawaii, 4 islands, veinclinicsofhawaii.com. You can learn a ton of stuff about what happens there. The reason why I thought it was exciting that we're talking about blood clotting today, some of you may not think, gee, that's not that exciting. It's exciting to me because I think that, for instance, when you have procedures, and I know that a lot of people that remember mom or grandpa's vein surgeon, that there was a lot of bleeding. Some people had to get blood put into their system. And the treatment procedures now, you're clotting up and you're out of there. Okay? Isn't that about it?
Yeah.
Are there still some people out there that don't want to go to a vein doctor because they remember that, oh no, man, mom had a horse, she had to take blood. She didn't go to work for a month.
Oh yeah, we fight that all the time. We fight that all the time. But the technology has improved so much, and it's a far different world right now.
I'm thinking 95% of what happens in your office, people walk in and walk out.
Yeah.
And while there is obviously what you're doing is surgery, there's going to be some blood. I'm guessing far less than the old procedures used to have.
Oh, much less. Yeah, much less.
Was there a time when you did that in the beginning? And even if sometimes it has to be done now for whatever reason, where it is really surprising how much blood, how quickly people bleed, and how you have to work really quickly to get it to stop.
Yeah. And veins, just in general, when you look at vascular surgery, veins are much more difficult to deal with. The bleeding from veins is much more difficult to deal with than with arteries, even though there's more, blood and pressure in the arterial system. But it can be a challenge, no question about that. So, there are other things, other factors can be deficient, and that's going to lead to bleeding in some people. Some people will be deficient in their platelet count.
Okay.
That's the molecule.
And that needs constant monitoring, right?
It does, yeah. And there's a variety of different reasons why somebody might be low in platelets. But if you're low in platelets, you're going to have a greater tendency to bleed, There are clotting factors that are what we call vitamin K dependent. So you need vitamin K to produce and maintain these. There's 4 of them, four clotting factors, and that's important because of the fact that we use that, we manipulate that when we want to give people a blood thinner, or when we want to thin their blood. One of the most common, blood thinning medications that has been around for years and years is a medication called Coumadin.
Coumadin, I've heard that. And what about heparin or something like that?
Heparin thins the blood, but it's used. They're used in a little different scenario. But typically for Coumadin is the oral medication. Many people in the past, when they've had a blood clot or something, were placed on Coumadin. And Coumadin blocks vitamin K.
Yep.
So that's the way that it's blocking that molecular mechanism, that cascade, and it's going to thin your blood.
I've often wondered, and I know this happens, how often you require blood work from a patient when you need to find out, things. And I do know my own personal, I at least twice a year get blood work done. And sometimes it'll show you in a range what all the things that you're supposed to have. If you're supposed to have a 0.1 and you don't, there's some things that you can take to get that, like vitamin K or B12 or any myriad of things. When you talk about that, if somebody hears vitamin, I heard the doc talk about, I'm going to start taking a bunch of vitamin K. Are there bad things about some of these things? Can you take too much of that stuff? Or any supplement?
I think, probably any supplement you can. Vitamin K, but your body has mechanisms to kind of get rid of those types of things that you're overly taking and not utilizing. I think
a lot of people are taking stuff they shouldn't take.
Well, there's a lot of overuse of vitamins.
Yeah.
There's a lot of vitamins that just get washed through the body, and you don't really have much benefit from it. I think excessiveness in many things is not a good thing. But things like infection. Mm-hmm. Infection can create a situation where the clotting mechanism is diminished and can lead to bleeding. So a number of different things.
Let me ask you this, because a lot of times people will have an injury or a puncture or a laceration or something and, treat it and it clots, which is good. And I remember my mother, and I'm sure there's a medical reason. Don't pick at your scab. Scabs are good. Don't touch the scab. They're supposed to come out on their own. What in the scheme of things is a scab? I need to know.
Yeah, well, for the most part, in many situations, your mother was right, because it can be, it's dead tissue and fluid and crust, that sort of stuff. But it is, there is a purpose for a scab. It's protecting an underlying.
Yeah. You're trying to heal underneath it, right?
Sure. Yeah. And if you scrape yourself or cut yourself or whatever. Initially you're going to have a scab kind of thing occur, and underneath that scab, there's healing going on. Mm-hmm. Healing is a process. And healing is a process that, comes through the blood system and is affected by, inflammatory cells and all this sort of stuff. But, that process takes a while. And, over the course of the time that tissue is rehealing, but the skin is coming back together, the scab essentially is protecting it.
Yeah, what I heard was, my mom explained this to me, rest her soul. What a lovely lady my mom was. She used to say, look, a scab gets pushed out and pushed off you by the new stuff underneath. And that's why I remember it like it was yesterday, although it was 6 decades ago, when everybody was getting chicken pox. And the natural thing was they were itchy, right?
Yeah.
And every parent would tell every kid, that's going to be a scar forever. And sometimes it is.
Oh, yeah.
Isn't that interesting? When you see a scar, somebody has one, that it could be a chicken pox or maybe even from a vaccination.
Sure.
You have your whole life.
Well, yeah, your mother was a very bright lady. She, as far as like pushing the healthy tissues is developing, is pushing that scab off. That's right. Yeah. That's why the scab is there, to protect it so that the tissue will heal properly.
She used to tell a story, and I know you get a kick out of this, and now that I'm a grandfather, I know what it's like when you have to tell these stories, that every now and again it's like when you have a loose tooth. Yeah. It has a progression of things. Tying a string around it and slamming the door is probably not a good idea, but that's what every kid wants to do.
Yeah, sure.
So anyway, but I think that this is pretty good, because I think everybody is there listening. And by the way, if you need to know more about what we do on these programs, you want to see a lot of other stuff, what happens at Dr. Juliff's offices, don't forget the Vein Clinics of Hawaii are located on the Big Island of Kauai, on Maui, and here in Honolulu. And you can go to veinclinicsofhawaii.com and learn some of this stuff. But I think just because of the nature of what we're talking about today, it crosses over certainly not just your practice, but every day, every way, people need to know about this stuff.
Sure.
And what affects, what's a good clotter and what's a bad clotter.
Yeah, well, and that's true. Some people don't clot well enough, like those people who have hemophilia. Some people clot too much. And, if in people who clot too much, it's either there's an overabundance of that, molecular mechanism in our blood that creates clotting. So you could have excess clotting factors. You can have excess platelets that we talked about. So, when people have too many platelets, we measure the numbers and we monitor the numbers.
If you find out you have too many, should you donate a few?
Well, you could. Yeah. You can do that.
Incentivize you.
Usually we don't, phlebotomize for too many platelets, but there are antiplatelet medications that we can give, and we do in many situations. So there's either an overabundance of clotting factors, or there's not enough of those things that are keeping the clotting mechanism in check that I mentioned before.
Yeah.
So, in those things, three of the more common ones are something called antithrombin 3, protein S, and protein C.
Okay.
Those are just names. But most of these are genetically predetermined. So this kind of stuff.
This kicks in. We talk about this when we talk about veins. A lot of what's going on with you is hereditary, maybe not affected by your diet, but I guess with this, that some of it can be. You can be aggressive at trying to get your blood to be whatever normal is.
Well, I think the point there is that, if you, since they're genetic, and we get our genes from our parents. If your mother or your grandmother or whomever, if you hear, over the course of time, gee, she had 3 blood clots, she was in the hospital 4 times with phlebitis and blood clots, then you have to wonder or consider, are her offspring also being affected by some genetic thing that some genetic abnormality that's making their blood clot a little easier than most. Now, your grandmother, when she was living, we had no idea about all this stuff. Yeah. So, that's where some of this stuff, although it's kind of, clinical and scientific, it's good to, bring it into a practical sort of scenario and think about those kind of things. So, because it is genetic, there's a variety of severity based on the fact that, we've got 2 genes that determine things, and if you've got, you can have 1 gene or 2 gene for either a good thing or a bad thing. And if it can be a bad thing if it has to do with this, anti-clotting mechanism. Some people are, if they have both genes that are active for this clotting abnormality.
I hear what's coming here.
They can have major problems.
Okay, now obviously, I don't know if there's any statistical data about. We have often discussed on the show the percentage of people that get vascular disease that needs treatment, and that number starts dwindling. I mean, the very, very serious vascular conditions happen to a relatively small part of the population. But what about this clotting? I mean, are there some people that just never have to worry about it their whole life because they're just one of these they got magic genes? They're good clotters.
I think, again, you kind of have to look at your own medical history and look at your family's medical history, because some of these, clotting abnormalities, and we refer to that as being hypercoagulable.
Okay.
Those are people who clot too much. Now, we mentioned a few, the antithrombin 3, protein C, protein S. Probably the most common one is called factor V Leiden mutation, and a lot of people have heard of that one. And a lot of people have heard of it because it's not all that uncommon. It's thought that 5 to 8% of European descendants will have 1 gene for that factor V Leiden mutation.
What's the problem with it?
If you have that, then it interferes with your clotting mechanism, and you make clot too easily.
Yeah, I'm having a problem wrapping my mind about that.
Yeah.
I just got a big cut. I would think the quicker that clots, the better.
Yeah.
But maybe there is a point in which your body's trying to assess what happened to it. I don't know. Why would you want it to take longer?
Yeah.
What's too fast?
Yeah. Well, it's not the speed, but it's the propensity. So, where does something like that come into play? Well, we talk all the time about people being on airplanes, long plane rides, long car rides, long train rides, or any scenario where they're going to be immobile for a prolonged period of time. If that person is at a much higher risk
I'm thinking,
of developing a DVT, a vein clot,
right.
as opposed to somebody who does not have that gene.
Okay. Even though most of the bleeding that we're talking about here is trauma or otherwise related to a puncture or something, so it comes out. But in many cases, isn't there bleeding going on inside?
Sure.
And that's probably even more spooky because you have no idea.
Yeah, well, and that's what happens to some people with severe hemophilia. They have spontaneous bleeding into their joints or into their organs, and over time it creates a tremendous problem.
Yeah.
So you can have bleeding. Yeah, you can have external bleeding. You can have internal bleeding. You can have external clotting. You can have internal clotting. And sometimes most of the time we know. Sometimes we don't.
Well, jump on that when you're doing your vascular treatments, and the program is Vein Centers of Hawaii, and the reason why this happens is because I do know that most of the procedures deal with clotting, because you're going to be in there and you're going to either use your sclerotherapy and put the salt thing in it, but sooner or later there's some blood. And I guess you count on it clotting, because you're certainly going to say, well, you're done, and out the door they go with the blood trail behind them. That's got to all finish off.
Yeah, we to do the procedures that we do. Yeah, we do have to enter the vascular system.
Yeah.
So we're puncturing veins primarily, and it's not a problem in 95% of people who have normal clotting mechanism or are not on medications that might affect their clotting. So we finish our procedure, we put a little compression dressing on it, and they're fine. Some people who are on blood thinners or have medications are often the offending feature. But they will bleed a little longer, and we have to do sometimes we have to put a stitch in the access site or whatever. But typically we'll take care of it. But I think from our standpoint, we get more concerned about the other side. People who have the greater propensity to form blood clot. In those people, we have to be a little concerned because we're fooling around with the veins. The procedures that we are doing are on the veins. The veins are where blood clots often happen. And again, that's another time when it's important to know whether a patient has one of these genetically predetermined type of conditions that may make them more likely to clot. We don't want them to clot.
Mm-hmm. Okay, now, at the risk of sounding like the bonehead question of the program, I have one, and that is, you mentioned earlier Coumadin, and we're all familiar with things that are out there that you take to thin your blood. By the same token, is there a pill that you can take that will thicken your blood? Is there something that you can take orally if you are a hemophiliac? There must be something, because otherwise they'd all be dying. They'd all bleed. What do you do about people as far as medicating so that they do clot?
Yeah, unfortunately, there is not a pill.
Ah, okay.
An oral medication that we can give, at least right now, that is going to supplement the clotting cascade proteins. So people with hemophilia, they're I guess. They're locked into, if they need it, having periodic blood transfusions.
Okay, and most of us are in the proximity, geographically, being able to get medical assistance for most things, but there's still a lot of people that live in remote areas and everything that really have to prepare themselves a little bit more for these kind of conditions. And I'm thinking, all right, we already are reasonably certain that we're going to clot. And yet, if you don't see it, you have to know the ABCs of it, right? Which is holding on the pressure, elevating, doing some of the other things we thought about. In some respects, it's kind of sad that they haven't developed something that would do that, to thicken it up a little bit,
Yeah.
like you do a stew.
Yeah.
Put some cornstarch in it. It'll
Yeah.
thicken it up.
It has to do with what you're trying to supplement and the inability, at least that we have right now, to get an active protein from our mouth into our bloodstream, because our digestive system tends to break those down.
But the light at the end of the tunnel, if you will, and once you've been identified, I want to go back, if you don't mind, for a minute, and talk about more and more people that have diabetes or other things that need to have blood treatment. Is there anything that happens at that? What is, so for instance, for those who don't know what dialysis is, what is that? I mean, you go in and they're going to take the blood out of your body, put it through some machine and put it back in your body. What is that? What happens? It's about sugar?
No, it's not. It's not about sugar. It's those people have to have some readily available access into their vascular system, and many of them have what's called a dialysis graft or a fistula. But you stick a couple of big needles in
the veins, right?
Into the wherever the access is obtained. And those needles lead to tubes, and the tubes lead to a machine. So, one tube is taking blood out, going through the machine,
like a filter,
filtering
right?
it, filtering it, and possibly removing water, and then the other tube brings it back into the patient. So, does there have to be some mechanism that interferes with clotting, because that blood is coming out of the body and it's being exposed to foreign surfaces, etc. There are steps that have to be taken to
it
make
takes
sure
a while,
that
right?
clotting doesn't
Some
happen.
of these people there for hours.
Oh yeah, several hours. 3 or 4 times a week.
Yeah. Which is, and look, we live a lot longer, but that's why. Come on, give me a pill. It's about time to get a pill for that. But the same token is, it used to be that certain people couldn't give blood, so that must mean that there's a lot of other things that fluid carries around in your body. Some are good and some are bad.
Oh yeah.
It's interesting, isn't it?
Yeah. The blood is a very intricate, thing. There's no question
I had to do a blood draw a while ago. And the guy said, "You're kind of watery. Are you dehydrated or whatever it is?" And I said, "I don't know. And is there a difference at time of the day or time of the year or time of the month where people might be a little more fluid than others?"
No, I don't think that it is related to time or seasons, day, whatever. Might you change it? Might the consistency of your blood change a little bit from time to time? Yeah, but not tremendously.
Because what I was saying before, when you get the results of a blood exam, depending on what sort of lab it went to and what they're looking for, it's pretty concise. I mean, isn't that a big tool for you and for all physicians, by saying, well, let's get a blood test. Let's see what's going on.
There's a whole host of blood tests, but and there's a variety of blood tests that we do to look at how well the patient's blood either clots or if it overly clots. So, for instance, those people who we see in the office, and we see a fair number of those people, that they have a higher propensity to form blood clot than the normal population, because those are the people that end up with DVT and venous problems, etc.
I'm glad you say that, because I've seen a few of these things at late night TV again, and not just late night, just TV in general. And they're mentioning these things more, which I think is important, because most of them do take the trouble or do take the time to explain that a lot of times it's happening the trauma of travel. And we've talked about this a lot. Aren't there some times when you will tell a patient it's not really a good idea for you to go to New York next week? We need to fix you a little bit more before you do that.
Oh yeah.
Or maybe there's going to become a time you may take that off your list. You may not be able to do these things anymore.
Well, we would hope that wouldn't happen, but yeah, there are definitely situations at whatever point in the a disease process. For instance, if somebody comes in and we find out that they have a blood clot in their leg that they just developed, then you're not going to want them to put themselves into a scenario where they're going to be at higher risk to develop, either more or another clot or whatever. So
but I still find this fascinating because when we first started talking, Dr. Juliff, by the way, medical director at the Vein Clinics of Hawaii. Go to veinclinicshawaii.com to learn some really cool stuff. But the topic of the program today is why does blood clot? And I'm still not 100%. At peace with the answer, but I do know that because if it doesn't clot, you have an issue. You're bleeding too much, and there's a finite amount of blood. So the question arises: does everybody have about the same amount of blood, or is it strictly to do to size and sometimes age?
It's dependent on size, but it's roughly the same. Everybody's got about 5 to 6 liters of blood in their body. Adult people.
So if you're really big, it's spread out over a bigger space.
Yeah.
So to speak, I guess.
Yeah.
I always wondered about that because you would think big person, big time. And I remember when I was donating blood, and I still do, when I was donating, you think, but why can't I just come back in every couple of weeks? I'm a big guy. You can take more. But it's pretty much about the same, isn't it?
Yeah. So, the other week we were talking about some historical things, and there, with respect to the abnormal type of blood clotting, there was this guy named Rudolf Virchow, and he lived back in the 1800s. He was born in 1821. He was German. And he was, sort of referred to as the father of modern pathology. And he defined something that we call the cell theory, which is based on cells and their function and how they interact, etc. But he was the first one that defined pulmonary embolism. Now that's important because the fact that blood clots typically we develop blood clots in our legs and in the veins in our legs. And
I kind of know where this is going, gang. Wait till you hear the rest of this line of thinking.
And occasionally, that blood clot can loosen and break loose, and then follow the venous circulation up through the heart, and then it goes into the lungs, and that's called a pulmonary embolism, which can be a fatal event.
It can be fatal, right?
So this is back in the mid 1800s, and this guy Virchow, who was a very bright guy, figured out the fact that blood clots from our legs or pelvis can actually, break loose, travel to our lungs, and create major problems. Now, wait,
one fast question here. That means that if you have venous conditions, that you probably have clots in a lot of different places, some bigger than others. And I remember you showing me a diagram of how long a blood clot can be. Most of us think as a blood clot when we have a puncture in our hand and we can see this thing, which is like a little scab, blood clot.
Yeah.
But from what you say, some of these are a foot long.
They can be.
Yeah, I mean, and so doesn't that stand to reason that if there's a trauma to that thing, it can take off? How big are the pieces that are going to hurt you?
Well, just about any size. When we see people with pulmonary emboli, sometimes it's one huge clot that has gone to one lung or the other. Yeah. Sometimes it's a bunch of little ones that have gone over all over both lungs. So there's different patterns. But I just wanted to correct one thing that you said.
Only one? I'm batting 1,000 if it's only one thing you're going to correct.
Yeah, just one.
Remember, it is not Dr. Juliff and Dr. Buck. It's Dr. Juliff and Da Buck.
Okay. So, if you said before that if you have vein disease, you probably have a lot of these clots all over. That's not necessarily true.
Good.
Because, there's plenty of people out there with vein disease, venous insufficiency, and they don't have, blood clots. Now, the flip side of that is that if you have venous insufficiency and there are functional problems with your veins, you are at a little higher risk to develop a DVT.
Okay, that's why I asked. Let me do one more part that maybe will help this too, and that is, we often talk about the valves, and when you have these valves that are malfunctioning, that sometimes that's where a clot's going to be.
Yes.
Okay, so that's what I was thinking about. If it's a big valve and you get a big clot, that's probably a little bit more to worry about. So these are some of the things that you have an ultrasound that's going to show these things, right?
Yeah, the ultrasound will show it.
Yeah.
But yeah, so when people, people with venous insufficiency, they're a little higher risk to develop a DVT. But people with people who develop DVTs, it's not necessarily because they have venous insufficiency. There's a whole different, a wide variety of reasons why they might develop that. But the concept of blood clot breaking loose, forming in the veins in the legs, breaking loose and going to the lungs was developed by this guy named Virchow's. Now, there's something in medicine called Virchow's triad, and Virchow's triad has to do with 3 individual scenarios that will make people more coagulable or hypercoagulable, or I guess the propensity to develop blood clot. One is injury of a blood vessel.
Okay.
So
trauma.
Trauma of any kind is going to spark a chemical in a molecular situation that's going to form into or that's going to result into blood clotting. The second thing is stasis. So, and that's what we talk. That's what we
hear
mean.
more and more about this stasis. What does that mean?
Well, the stasis just means lack of movement. So, and what we mean by that is stasis of the blood. So, if somebody's sitting on a plane for a long time, again,
that's the point.
Back to the plane scenario. Since we're sitting down or we're laying down and we're not getting up, we're not walking, we're not, our muscles aren't contracting, and the blood in the veins, especially in the leg, can become very static. It's not moving. Well, that makes that blood more likely to clot.
Maybe especially because it's down at the bottom, it's gravity, and the heart's a big pump. We all know about that. And there are no other pumps, but some of the muscles, like the ankles and the calf muscles, if you move them when you do these long flights, you're ahead of the game, right?
Yeah.
But you've said, the best thing is they wander about the cabin.
Sure.
But now sometimes because of security and other reasons, the airlines don't want you wandering around the cabin.
No, they don't.
Yeah.
They make it hard. They make it hard for you. But you bring up the heart. The heart is the muscle that pumps blood through the arteries. But the other thing that you said is the calf muscle and the muscles in our legs. The contraction of that muscle also is extremely important for blood flow.
So if you're just sitting there and not doing that for 5 hours,
right?
Okay, I get it. That's the problem.
And also because of the fact that the veins in our legs have a fairly significant capacitance, which means that you can pool a lot of blood in your leg veins. They just kind of dilate; they get full of blood, and as that blood becomes more static, then there's more propensity to develop a blood clot.
Can that DVD, that deep vein blood clot, can that happen quickly?
Oh, yeah.
See, that's the thing. We often talk on the program, folks, and the program is every week. Tell everybody. And go to veinclinicsofhawaii.com, learn more about this. We talk about this all the time. And it's I guess, comforting to know that, when you're going to do travel, you can't get an examination before the trip and think, well, that's good. I'm in great shape. Nothing's going to happen to me. You still have to be aware that your body going through these changes in travel, you need to make sure that you're getting some sort of movement. Right?
Sure, right. Yeah, and those recommendations that they have in the airline magazines about moving your feet and bringing your knees up to your chest and all that sort of stuff, they're good recommendations.
Let me ask you one question that has to do with this, because I know this happened to me once years ago, knock on wood, and I don't do it anymore. How many people will tell you that they're traveling, and to be more comfortable, they took their shoes off? And now I'm traveling from Hawaii to New York, right? When I get to New York, I bend over to put my shoes on, and they won't fit.
Yeah. Because
your foot's swolled up.
Yeah.
What in the heck's going on with that? Inactivity? Gravity? What?
Well, yes and yes.
Yeah.
I think that if it happens, it depends on how severely that has happened. I think probably, many people, even with normal veins, if they're, sitting down for, 8 or 10 hours at a time and not getting up, et cetera, they might develop a little bit of swelling, but that's going to be even more pronounced if you also have venous insufficiency. If the veins aren't working, then the blood's not going to come up the way that it should.
That's a great point.
And, you'll have more pooling in that, that pooling creates pressure, and that pressure, leads to fluid being, drawn out from the vascular system into the soft tissue of your lower extremities. And that's what edema is all about.
Every now and again, and you talk about edema, every now and again, more and more people are doing this because of the workaday where we're all busy. We start recording our favorite TV shows. Let's say Hawaii Five-0 is your favorite TV show, right? And you record it, and then you're going to have a binge-a-thon. And you're going to watch 5 of them.
Yeah.
And you're not doing anything except watching one after another, consuming stuff, and getting blood clots.
Right.
Seriously, isn't that a concern?
Yeah.
Yeah.
Well,
No moving for 5 hours is not a good idea.
Well, immobility and also dehydration.
Mm-hmm. Yeah.
So, people, a lot of people, you're sitting down, you're not doing much, you don't really feel very thirsty, and, you tend not to drink much, or you drink things that are not, being beneficial for you, like alcohol, which alcohol will actually act as a diuretic and make your body get rid of more fluid, So you have to pay attention to those kind of things.
The reason why I thought it was so cool that the doc wanted to talk about blood clots today is because obviously it is in every single facet of everything we do. And what we really, when it first started out, we talked about, the question was, why does blood clot? Well, I think almost everybody'd have a pretty good idea now, because the consequences would be dire if it didn't clot. But somewhere in between does it clot too quickly, or does it not clot quickly enough? How do we put a label on ourselves? For instance, we talked about a bleeder. Don't most people know that their doctor says they're a hemophiliac and they're a bleeder? But what about regular folks? How can they find out what their propensity for blood clots are?
Well, okay,
what's good and bad?
There's two different things there, and that's a very, very good question, because that's kind of like the bottom line to everything that we're talking about today. So you've got people who don't clot well enough; they're going to have a propensity to bleed. I think that most people, if they have a substantial, or if the abnormal bleeding in that person is significant, most of those people know. Most of those people know that they have a bleeding tendency, and they go to the doctor and they find out what it is. Can you find out what that's due to? Sure. Yeah. There are blood tests and all that sort of thing. Yeah. And there are blood tests that will tell you how well your clotting cascade, the clotting mechanism, is functioning or not. And we can actually measure the levels of the clotting factors and all that sort of thing. So it can be defined. I think the bigger problem are those people who clot too well, who clot too much, because often they have the genetic predisposition to develop blood clot or to be hypercoagulable, like we said, but they don't know it.
Oh, yeah.
So,
knowledge. Gotta have the knowledge.
In their first, the first event that may occur is a huge DVT that turns into a PE that can be fatal. So you have to know your family history.
And unfortunately, a lot of these things have to do with travel. Everybody wants to travel, and we're living a lot longer. And you say, by golly, I've earned it. I'm going to travel. I guess if you have a venous condition or a blood condition, you really ought to talk to your doctor before you do something, especially if you're going to be away for weeks on end.
Yeah. Absolutely.
Okay, if you want to know more about this or any of our other programs, I'd like you to go to veinclinicsofhawaii.com, veinclinicsofhawaii.com. And the reason why this was so good, and we hope that you've learned a little something, even though it's not to do with the venous clinic that goes on with Dr. Julep, but everything else that we're talking about. So if you need to know more about this, I suggest you contact your physician. And if you need to have an ultrasound to find out how your veins are doing, I think you ought to call Dr. Julep. So thanks for listening. We'll see you next time. In the meantime, remember that this blood of yours is pretty good stuff. You got to keep good looking. If you're not clotting enough, get to the doc. Get clotting.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.